Hi, this is Kim from Body Solutions Therapy, and what I wanted to share with you today is what I consider to be one of the keys in helping you to address pain or other symptoms in your body. And what the tip is that we need to identify the motion or motions that contribute or increase our symptom that we are experiencing. And this is really important for a couple different reasons. So number one, it's going to establish a baseline. By establishing this baseline, we can assess where we're starting. So for example, if I know I can move my arm to here and that's where I start to have the discomfort, that's my baseline. I can then go and do my intervention, my stretching or exercise, and come back and see is that movement pattern the same, better, or worse? So those are the three things that can happen. And you might be wondering, if you're going to be able to see a change that quickly, because you're thinking maybe it's going to take a few weeks or several sessions before something changes. What I've found is that typically when you are working in the right area with the right exercise is that you should see a change in a positive direction right away. So just like anything in life, there's multiple ways of doing something. And there's always certain ways that are going to work better or quicker than others. So we're always looking to hone our treatments into what works the quickest and the most effective. So the second thing that knowing what movement triggers our discomfort is going to do for us is allow us to analyze what we do during our daily activities or become more aware of what activities might be triggering our discomfort. So you may have had the experience that you have a treatment, you feel a lot better, maybe 100% even, and then all of a sudden it seems like out of the blue this symptom reoccurs maybe just a few hours later. And you're wondering, how did that happen? So, we're either moving or we're in a position during the day. And either one of those can be something that sets us back. So if we know, for instance, that a movement pattern such as raising my leg increases my symptom, and it's at that end range, what we sometimes don't link to that is that, I go and sit in my favorite chair and I pop my feet up and, I don't feel uncomfortable when I pop my feet up because they're only going up a little ways, not the extreme that I just showed you a second ago. But basically it's the same movement pattern. So when I do that, there's still being some tension put on the tissues. And over time, that tension reaches a point of irritation and then I start to feel pain. So by establishing the motion that ties into my pain, we can really, again, try to minimize what we're doing during the day that might be setting us back and slowing down our progress. So now that we know why it's important to establish what motions tie into our pain, we need to make sure of how to identify those motions. There's basically 6 different directions that most joints are going to be able to move in, so I'm going to go over those with you. These are a starting point to help you systematically, assess the joint where you're having discomfort. And you want to make sure that you move very slowly and all the way through that end range to see if you have any discomfort, a limitation in the range of motion, or a change in the movement quality or a difference in movement quality. So the 6 different directions are: number 1, moving forward; number 2 is moving to the back; number 3 is moving out to the side away from the body; number 4 is moving side across the body; number 5, rotation in; number 6 is rotation out. So if you don't have pain with any of the basic movements, you want to compare right to left sides to see, again, if there's a difference in the movement quality or how far you can move. And that you can use as an indicator if there's a difference between your right and left sides. So once you've established what motion or motions link to your symptom, this is going to be a really effective tool for helping you to assess, the treatment interventions that you use, as well as assessing activities that may be triggers for you. So your homework is, number one, check in, see what are the motions that increase my symptoms, okay? And then number two, once you've established those motions, is whenever you do a treatment intervention, check in before and after to see what effect your treatment intervention had on that motion. And then also check in throughout your day. So if you check in the morning and everything is moving okay, and then you check in a little while later and you're not moving as well, maybe you haven't got pain yet, but you're noticing I can't lift my arm as far as I could earlier, that's a sign that something that you did in between there might be setting that off. So you can backtrack and examine some of the activities that you did and see if you can identify something that might have been a trigger and adjust it accordingly. So once you've really developed this awareness, it's going to be a really powerful tool in helping you to get better. So hopefully these tips will help you out. Let me know what you find, if you have any questions, and if you do find something helpful, make sure you share this with your friends and family as well. All right, thank you.